are incredible organs that allow you to see the world around you. It gives you the power to experience life to the fullest. Hence, whenever eye problems emerge, they take a toll on your daily life. For instance, cataracts cause vision loss if it is not spotted early. Cataracts are prevalent, but still there is much false information about them. You must understand crucial cataract facts to spot the signs and symptoms immediately. Plus, you realize how important it is to get routine eye exams. Today on your regular hair talk show, The Physicians, we'll be discussing cataracts, myths, and the truths you need to know. Stay tuned. It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agbere, a regular anchor on this program, and we're discussing cataracts, the facts and myths. Of course, I'm not going to do this alone. I'm with my very, very elegant, as usual, co-anchor, Doctor.
I'm Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
And will always remain our business. Dr. May, we're talking about cataract, but today something totally different from how we've always handled the program.
Okay,
the topic. Most times on cataract, we talk about what's the definition of cataract, the prevalence, we talk about the signs and symptoms, the complications, and all the stuff. But today, because of a lot that is going on social media, we can't be seated and allow social media to take the breath out of us with lots of misinformation.
Yeah, and disinformation.
Exactly.
And so doctors.
Google doctors. Internet certified doctors. So that is why we're here as the physicians to debunk some of those things. We decided today that we're going to take it down, let people know about the facts.
And I think I like the angle we are taking it when we are saying let's bust the myths, right? And let people know what is right versus what is not right, and what they should start doing differently. Because information, they say, is power, but it's the application of the information that is the real power.
Absolutely.
And when people know what they should watch out for, what they should look out for, and all the limiting beliefs, a lot, like for example, when I was growing up before I went to med school, the idea was that cataract only affects the elderly. You know, that was what,
very, very serious.
And then, if you are reading too much, those, in Nigeria, we call it efiko, and the medi people, and all those kind of things. They'll tell you that if you read too much, that you have cataract. But now we know better. And some people will still be in my shoes of how many years ago and still be thinking that same way.
You have no idea the myths that I've heard about. How about the ones that will tell you that they need to put breast milk in the eyes of the baby so that the baby won't have cataract?
No, for adults, they say red palm oil. The palm oil can solve every other thing.
Let's hold on. We'll have the expert coming to tell us more about it.
That's it.
So, we'll be back after the short break. Just ensure that you call your friends or family, your neighbors, and the physicians about they've just started. Back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.
Welcome to your favorite health TV talk show, The Physicians, where your health is our business. Today we're discussing cataract, facts, and myths. And with me in the studio, our guest is a consultant ophthalmologist. And she is the chairperson of the Ophthamological Society of Nigeria. She's no other person than Dr. MODUPE OLORUNNIMBE. Welcome.
Thank you for having me.
You're welcome, ma'am.
Thank you.
So now we want to talk about cataract, the facts and myths. But before we can proceed on that very, very important topic, I think it would be good for our audience to first of all understand what cataract is, that when they hear the facts and the myths, they'll be able to relate properly. So just tell us a little bit, when you talk about cataract, what is it about and how is it formed?
Okay. Cataract is a cloudiness of the normal human lens. We have lens in our eyes, and they're meant to be transparent for all the days of our lives. But things happen, age happens, and then some parts of the cataract becomes cloudy. And once it is cloudy, it becomes opaque. Light is not allowed to go in, and then you can't see clearly. So you start with blurring vision, and the blurring vision becomes more and more profound as time goes on. The most common cause of cataract is age-related. Okay. So we're not surprised to find cataracts in 60 years and above, but it can occur at any age, even in newborn babies.
So it's good that we are talking about, because I'm sure you, before now, you heard us talking about the fact that age, from what when I was growing up, right, that it's only older people, yes. And the fact that you are saying now that, it's age related. So it's not like 60 years and above, they are more prone, but it can happen to any other person. So what are the predisposing factors? What can make somebody to have cataract?
Okay, I'll start from childhood. Some babies have been infected while they're
babies.
Some infants are infected by maternal diseases while they're in the womb. So they are born with congenital, we call those ones congenital cataracts. Trauma causes cataract as well. Recurrent infections and inflammations of the eye cause cataract. Systemic diseases like diabetes cause cataracts. And drug use, some medications predisposed to cataract formation. So you can have all of those in any age group. But the commonest form of cataract is the age-related one. It's actually like gray hair.
Yeah.
I mean, if we all grow old enough, we would have gray hair.
Yeah.
So.
Now you talked about that. So quickly, before going to the myths, how does one know that the person has cataract? The symptoms?
Yeah, the most common symptom is blurring of vision.
Okay.
Bear in mind that has to be in a person that could see before and notices the difference. In childhood, cataract, they may not know because they never knew how they were supposed to see. So they think that that's how everybody is supposed to see. Medical examination should take care of that. But the common symptom is blurring of vision, falling over things, not necessarily seeing what you are meant to see, what every other person is seeing. Some people see halos around the light. Some people have double vision. Depending on the location of the cataract on the lens, it splits vision in any way.
Okay, so now you talked about the symptoms. So let's just begin with the myth. Because some of the symptoms, you didn't talk about pain. Some people will tell you, I don't have pain, so I don't have cataract. Please debunk that.
Yes, it's a painless cause of blindness. The blindness from cataract, though, is reversible with surgery. But many of us have the attitude that if it don't broke, don't fix it. So when there's no pain, even when the doctor says, "Madam, you have cataract," the first thing the patient may say is, "I reject it. I don't have pain. My eyes are not red. There's nothing.
It's not swollen.
It's not swollen." And and that just give me glasses and let me go. They hardly believe that it's a cataract that's causing that.
Before I go to the second myth, there was something you said earlier regarding blurred vision, right? Is there like a duration, like our frequency? Because maybe hunger can make me to have blurred vision or headache. So is there like, if this blurred vision is up to 2 weeks or up to 1 month or whatever, that will now make, that's when you should reach out to a specialist? Is there like a duration to that?
Let me clear something. A person's perception of blurred vision differs. So if you are an accountant or a lawyer and you have to do a lot of fine print reading, you may notice a blurring of vision earlier. But if I am selling yam in the market, I can see my yam, I can see everything. So my perception. But the key thing with cataract blurring of vision is that it progresses. It's not the only cause of progressive blurring of vision, and that's why you need to see your eye doctor to know the difference.
That clarifies, and for me, that just gives me that piece that, depending on, number one, your even sensitivity to your
Yes.
being self-aware on who you are. I think this blood vision is not like headache or whatever. I
Blood
need to
vision
see
should
a
never
doctor.
be ignored.
Yeah,
It
I
should never
think that does clears it. Now I hear people say cataracts are preventable. You are the expert. Are
Okay.
cataracts preventable?
From the first thing I said, if it is age-related, invariably, if we all, you know, we don't all have gray hair at the same time. So some people may get the cataract earlier from 40. Some may get from 60, but it's age-related. There's no cause. It's a primary thing. There's nothing. The person is not diabetic. The person has not had any injuries to the eye. The person has not had infections to the eye, yet the person has cataract. So that's the primary type. There's no cause, but you will invariably have it.
Wow.
Now, is it preventable? It's preventable if you are diabetic and you control your diabetes properly. You delay the onset of bringing it on. If you walk in places where you could actually have trauma to your eyes and you take pains to protect your eye. So what you're doing is that at least you're trying to prevent it or delay the onset. Now, for some of us who live in bright sunlight tropics, we have a lot of UV rays coming in. And that is, you can't control that except you wear sunglasses. So it's hardly preventable. Okay. It will come eventually.
Some say two things. Some say when you read too much, it causes cataract. Another says when I use eye drops, it can actually prevent or stop cataract or cure cataract. Surgery can wait.
No. Okay. Both are myths. You can't overread too much and get cataract. I think that would have put us in a place of illiteracy forever. So we can never overread and get cataracts. It doesn't cause that. For drops, there's no eye drop that will remove that opacity in the lens. It is a surgical intervention that removes it. No drops. And I know someone who used drops, and by the time she totaled the cost of all the drops, because the drops were costing her, this was over 10 years ago, 30,000 a bottle, and she had so much faith in it. She ended up still, after spending what would have cost the surgery, she came back to the hospital for the surgery because the drops don't work. There's nothing I've seen it on Facebook, I've seen it all over the place. It's sheer waste of money.
You see, that was exactly
sheer waste of money.
I told her, because there's a whole lot of misinformation that is going on social media. And if you are not aware, people will just buy it.
It's not only the worst part is TikTok. In fact, there's a recent study that says that 33% of the Gen Zers and millennials get their health information from TikTok.
I believe that. I believe that because a patient sits in front of you and says, ChatGPT says, this is what I have.
I will tell you, cataract surgery is dangerous and time-consuming.
Cataract surgery is one of the simplest surgeries for eye doctors to perform.
Wow.
Because it's very common. And so we learn it and we do it. And it's better to do it appropriately and nicely. Is it time consuming? No. With years, it has even gotten shorter and shorter. In 15 minutes, you're up and you don't even require hospital admission. However, is it dangerous? No, absolutely not. There's nothing that is dangerous that would make you stop, that would make you continue to be blind.
Sure.
But people are scared because of previous histories that we've heard. Half of the people that have complications, there's no surgery without complications.
Exactly.
There's always that 0.1% that would happen. However, there are instructions that patients are given. And if you follow the instructions properly, if they say don't bend your head, don't ask why. Just don't bend it. Because some of the instructions post-operatively actually appear to be bothersome. So many patients don't agree. If they say put in this eye drop every 2 hours, then do it. Don't say, oh, I'll put it in when somebody is about to do it. So the post-operative care falls on the family, not the doctor, because they go home immediately. And if anyone drops the ball there, then that is when you have complications and everybody says, oh, I went to do my surgery for cataract and I went blind. Straightforward cataract without any underlying or coexisting condition should give you your vision back.
Okay. So I had a patient, who came and said she actually had cataract, right? And she needed to go for surgery. And she came and said, doctor, I had a fibroid and they took out the fibroid. And now the fibroid has grown back. And they want me to go and do cataract surgery. But she's scared because she thinks that the way the fibroid grew back, same way cataract will also grow back. Is it true? Or is it a myth or fact that even after surgery, the cataract can grow back?
It's a myth. This is what happens. For cataract surgery, you are taking out the entire lens that was opaque in the first place. So that lens does not grow back. However, the base that the lens was resting on in the normal eye is left behind. And sometimes some cataract cells try to come back again. It's not the cataract growing back. And thankfully, there's laser to take care of that. You don't even have to go back into surgery. But because there's always a remnant of the lens left behind, but it's not, that doesn't happen all the time. The technique for cataract surgery has evolved over years. From manual removal of the lens, now we do phaco, what we call phacoemulsification. And that has reduced the remnants and the occurrence of a cataract growing back.
So we do understand, of course, and this is normal. This is what we even preach. Eat carrots. If you eat carrot, is good for you and all that. So there's this myth about, if you eat carrot, you can prevent or cure cataract.
Carrots contains vitamin A, and that is good for the eye, generally. The lens is only a part of the eye. So where carotene, the vitamin in carrots, work, is at the back on the retina and other cells. So eating carrots will not prevent cataract or cure it.
That is quite interesting because like I said, like we've been saying, that the internet has taken over a whole lot, and the information you get on the internet can be overwhelming. And there was a full-blown argument on this whole podcasting, until people started telling them that, look, go get an expert to debunk some of these things, and that's the only way we can. So that also took us back to the fact that some people also believe that if you take vitamins and supplements, that will prevent cataract.
Vitamin supplements are good for many things in your body and in your eye, but to say you are preventing cataract from it, if we all live long enough, people can be 90 and not have cataract, but if they lived longer, they will eventually get it. Yet people can be 40 and have cataract. It all depends on the constitution and how you've taken care of every other thing. Are you diabetic? Are you do you have trauma? Do you have infections? Do you have inflammations? All of those.
So before I let you go, some say after surgery I'll have near
blindness?
No, sightedness. That's almost like perfect after surgery.
Yeah, today's modern surgery can do that. It will, when you remove the lens, you've removed a great refractive power of the. So we put in an implant, an artificial lens that is calculated for that individual. The power is different for everybody. So you put in that implant, and once the implant is there, it gets you to see far very well. Modern day implants also have sight and reading. So you can actually put the implant in and you can see far and you can read well. And you become a star amongst your colleagues.
You said something about a patient, telling you about cataract and recovery. spending so much money and they're not sure that they will get what they really want. And just say, if I ask you to do these instructions, you have to do it. Do they usually, just for a purpose of understanding, I think if we are able to let these patients know, the individuals know, the reason why they are not to do a particular thing, it may likely help. It's likely to help. For instance, when you want to do the surgery, explaining to the individual, the patient, that this is the reason why we're doing the surgery, this is the outcome, this is what you are expected, then you follow the instructions. If you don't follow the instructions, these are the consequences that come with it. I think that would also help this individual.
I agree with you. And many of us doctors, we have pre-operative counseling, the nurses weigh in and post. I, in particular, have a family member also listening at the same time. So it's not just counseling the patient, it's also counseling whoever is responsible for the care.
Yeah. So one last question is we are talking about cataract and the management and of course the myths and the facts. So does this mean that you can't have cataract surgery if you have other eye conditions?
Oh no, you can. You can. Everything is brought under control, and then, but if you have other medical conditions, it may impact on the outcome of your own cataract surgery. But you see, anything is better, any vision you have following cataract surgery is better than not seeing at all.
Okay. Final word for our audience, just final word from you.
Final word, please don't be afraid of cataracts and cataract surgery. It's to a penny, kind of, it's safe, and please don't listen to myths about it. You need surgery to take it out. Yeah. At some point, you will need surgery.
Thank you very much for coming on our program. I hope one will call again will also honor our invitation.
Thank you very much for having us. Thank you.
And the viewers out there, I want to say thank you for keeping a date with us. And thank you for calling your family and friends to always watch the physicians, because you would always get the facts and debunk some of the myths. Social media is not it, please. We have a lot of internet certified doctors. Everyone is not a doctor on the internet, but be careful those you listen to. Always seek the truth from the doctors and keep watching the physicians. My name is Dr. Martina Agberie. Till next time, stay blessed.
Thank you very much, Ma. And of course, to our audience, thank you for always keeping the time with the physicians. You've heard all about the myths and facts today on cataract. Please, age is not by right. It's a privilege if you grow old. Hence the reason why, as you grow older, you are more prone to having cataract. And there's a treatment for it, which is just 10-15 minutes, you are out and you go back to your house. But make sure you have, when you feel that you are having blurred vision, depending on the kind of activities you do, see your doctor. Don't be a Google doctor. See your doctor. And if it's cataract, have your surgery done. Be kind enough to follow us on all our various social media platforms. And if you want to be a part of our program, just like how we have Dr. MODUPE OLORUNNIMBE here, go to our website, click on the form, fill it, and be here. You do not have to be a doctor. If you have a medical condition you want to share and educate people, this is the right place for you. My name is Dr. Memuna Yusuf Kadri. Thank you and remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.